Welcome to today's NIC Leadership Huddle. Is there an investment case for skilled nursing in the intra and post-pandemic world? The third leadership huddle of our 2021 webinar series. I'm Chuck Harry, NIC's Chief Operating Officer, and I have just a couple introductory comments ahead of our panel's discussion. If you need to adjust your audio for today's webinar, you have joined the webinar using either your computer speaker system or your phone based on your audio access during your most recent GoToWebinar session. You can adjust your audio access to today's webinar through either your computer speakers or your phone using the settings in the audio pane, which is located on the top of the control panel on the right side of your browser window. With that, it's my pleasure to introduce our moderator for today's webinar, Colleen Blumenthal, who is CEO and partner at HealthTrust, as well as the co-chair of NIC's Spring Conference Program Committee, whose members have curated the session for this year's leadership huddles. Colleen, so as we hopefully emerge from this pandemic, is there an investment case for skilled nursing?
Thanks, Chuck, and we are about to find out. I am really thrilled to be joined by extraordinary experts in this topic today, people who not only are invested in, but invest still in the skilled nursing space, namely Ben Reisman from TL Management and Wendy Simpson from LTC Properties. But if you will give me a little indulgence here, I want to start off by playing Debbie Downer. It was 357 days ago. We were in San Diego at the Spring NIC, and I hosted or did a moderating panel on valuations. And this slide, which I'm going to pull up next here, is something that we presented to the group. So pre-pandemic, we were already concerned that the actual number of occupied skilled nursing beds in the US was decreasing. Supply was decreasing, but actual demand was decreasing by about 7,000 beds every year before we even had a pandemic. And at that time, we attributed it to perhaps baby boomers being healthier and simply not having the same needs that the prior generation had. We thought also that perhaps to the extent that they were having surgeries, that they were rehabbing at home, and so there was home health diversion already happening prior to the pandemic. And then lastly, perhaps for long-term care, many of them were opting to keep their assets and spend down in assisted living rather than go the nursing home route. So that was 357 days ago. And then COVID hit. And if we go to the next slide, in fact, I Googled this morning, nursing home deaths. And there were 150 million hits in less than a second. And it feels like there's been a complete barrage of headlines, starting with Life Care Center of Kirkland and back in March, and it's still continuing to this day. Almost every day you can find either in the print media or on television, or today was the conclusion of a 2-day special, a New York Times daily podcast on, my mother died alone in a nursing home. And I think, it's a stigma that's going to impact everyone in the home, not just those that really, did not provide the standard of care that we expect. But the one headline that I don't have here that I think definitely impacts what you see on the next slide is the CMS order back in mid-March last year, March 13th, saying no visitation to nursing homes, not third parties. So made it more difficult for people who are looking to buy to do their due diligence, certainly for those looking to lend, to get comfortable with the assets. But more importantly, for the residents, it really impacted their quality of life as family members weren't able to come in and just give them the hugs and the visits and the birthday cakes that they had become accustomed to. And so I think consequently, you're dealing with the frailest population here. And the drop in occupancy relative to other types of seniors housing was far more dramatic for nursing care than it was for the other sectors. And while I think everyone had, some loss in census over the course of the pandemic over the last year, as we see on the next slide, it's been really choppy as far as how bad markets were impacted depending on where you're located. You know, it's interesting. Skilled nursing occupancy nationwide prior to the pandemic was roughly 80%, and now that's kind of the high water mark, and there's really very few states that are achieving that 80% level. Most of them are somewhere between as low as 55%, you know, and approaching into the mid 70s. So by and large, I would say from what we see on the day-to-day basis, you know, some communities maybe the overall impact is only a few hundred basis points, and in other communities that impact is over 2,000 basis points. And I'm an appraiser, and so I just have to throw in this last slide here, because I don't think you can talk about valuation without talking about cap rates. And for the, hypothetically speaking, if I had been doing this for 30 years, I would say that over the last 30 years, you know, cap rates have been for skilled nursing somewhere between 12 and 14%, pretty much year in and year out. And I would maybe even say really between 12.5% and 14% on forward-looking cash flows. Last year, we saw a slight uptick. It went from roughly 13 to 13.5, but it was not anything particularly extraordinary. And in fact, when you looked at the per bed values, it averaged over 100,000 a bed last year, which, while not record setting, was certainly not something showing a lot of distrust. So clearly, Ben and Wendy, you are not the only two who see opportunity in the skilled nursing sector. And I think at this point, I'm going to go ahead and just, you know, let's go right to the heart of the matter. Wendy, starting with you, what attracts you to skilled nursing?
It's a level of care that is needed. I mean, nobody goes to skilled nursing as something they've decided they want to do. Skilled nursing is a need-based service, and it's always been there, and it's always been supported by the government. And while in some investment decisions, people are a little leery about the government's there and they pay. There's been some disruption relative to managed care, but you know that has worked its way through the system. So I think what appeals to us is that it's a needed service, healthcare service within the United States.
Thanks. Ben, same question to you.
Yeah, I agree with everything that Wendy said. And I'll just add to it, just as an investor, you know, you're looking to deploy capital, there's always risk. But this is an industry that is established. It's been around for a while. It will be because of the need. But it's also, there is constant innovation as technologies improve, as treatments improve. So there's always a chance within an established field to kind of stay ahead of the curve if you're willing to make the investment. And another thing that's really nice for an investor to give them comfort that not every field has is, you know, I don't know how to change a bandage or teach somebody to walk again. We're dependent on the people inside the building. And the people doing that have, for the most part, made a career choice to do this because they care and they're passionate about it. So you have all these people going to work every day, doing something they're passionate about and they care about. And that gives an investor a lot of comfort.
That's a great point, and you're absolutely right. The operator makes all the difference. So Ben, back to you, or still with you. So overall, how did your investment activity in 2020 compare to prior years, and what's your best guess as far as how 2021 will shape up?
So I'll start with 2021. Deals are happening again. And I think it's also, there's a narrower field because nobody knows how long it's going to take for a census to get back up. So it's going to take well-resourced companies with good relationships with lenders to do deals. So I think it's going to be a strong year. As far as 2020, you know, obviously there were a few months where there was just a pause in M&A activity. But a lot of the deals that were supposed to close did close in the last quarter. But in terms of just investing in the assets, you know, during the second and third quarter, there was a lot of money spent in getting resources to the buildings to deal with the pandemic. And our principals, you know, spent a lot of money out of their own pocket to do this. You know, getting PPE, we tried to take everything that we can take out of the building, take it off their plate. So we had people that normally work on accounting, our CFO, going out and looking after PPE and paying whatever we had to pay to get it to the buildings.
Great.
So I guess
Wendy,
it was,
so investment is not just like what you pay to buy a property, but really what you put back into the property in order to continue to see it thrive and prosper effectively. Wendy, I imagine you did similar supports for your operators?
We did, but as a triple net lease, we don't, get involved in the operations directly. One of the things that we did is we immediately started, as Ben and his organization did, we immediately started asking people to help operators source supplies, because they don't necessarily have a network among themselves. So we have some of the smaller operators. And so if we found out that Brookdale had a source of supply that maybe another smaller operator didn't have a source of supply, we asked them if it was okay for us to let them know. And so we tried to link our operators. Relative to deals, I think 2020 was probably just the second lowest investment that LTC had ever made annually. I think we might have done zero in the 2008, 2007 time period. Outside investments, we spent a lot of money internally on our own properties. This year, it's been pretty slow, but we've had some LOIs issued, and so there's some activity both in the skilled and in the assisted living area. We're seeing opportunities in structured financing more, and we talked about that on our earnings call. And we like that because it's a small bite of exposure. We're seeing that the deal structures are showing much more equity in a deal than it had been before. And so right now, we're finding a relatively slow start to the year, but things are feeling a little bit better as the spring comes along than before. We've seen some pretty big deals, and I don't think LTC will jump out and do a really big deal at the beginning of this year. But I think it's positive looking at assets right now.
That's interesting, and I'm just going to pick up on something you said. So the big deals, I mean, what kind of appetite do you think there is generally for folks, that have those kind of opportunities, or those big deals be more likely to be chopped up and divided among smaller groups, do you think?
Well, HealthPeak did a big deal. I think Welltower's done a couple of big deals. It's a shuffling of assets among operators, right, things that we know about. But we've seen deals in the $65 to $90 million asking price. Now we've seen a deal recently that came out last year at 85, and now they're looking at 65. So it's a oleo of things. It's very many opportunities that are differently structured.
Yeah, and I think I'm aware of at least one or two where they just can't find a lender, quite frankly, to help them close. Right. So that's going to be a challenge. I mean, Ben, I don't know if you've got an opinion on big deals versus smaller deals, and what you expect to see more of this coming year.
I don't know about this coming year. I mean, we had some big deals and some small deals. At the end of 2020, when the things that had gone on hold actually closed, it wasn't a down year as far as M&A goes. And we had some big deals and some small deals, and nothing really changed. Even ones that we had the LOIs all drawn up prior to the pandemic, and then it went on hold. And as far as 2021, I mean, we're not seeing that many big deals, but we typically get one-offs or small portfolios. So I don't know. I mean, it's going to be a challenge to take over a large group of homes because, again, it's going to. I mean, having a lender is going to be important. Lenders are going to look for very strong borrowers, which they always do, but will be more important now because they know and we know that you can't just say, all right, there's a vaccine. I mean, we have seen census improve, And you saw that in the graph that you showed. A lot of the places that were in the green were the places that were earliest hit. Texas, which was red, traditionally has lower censuses, and also it's a big state, and the COVID was getting around the state kind of slowly, so it's not like it hit it hard in the beginning and then was out. So census is recovering, but to get back to pre-pandemic levels is going to take a long time. And so again, it's going to be because of the lenders and their comfort and them having to deal with people. They have relationships that are strong borrowers, that are well-resourced companies. It's the opportunities are going to be out there. It's going to be probably a smaller amount of people that can get the deals done. But I don't think you're going to see, whether it's small deals or big deals, any one type of deal that had been getting done prior. And there's also, we're not seeing steep discounts on deals. Not happening anymore. I think deals are starting to get, back on track as they were.
So when it comes to deals, what's more attractive, Wendy? Are you more interested in core opportunities, or some value add situations, or is everything pretty much distressed because of census and there is no such thing as a core asset right now?
No, we have core assets, none of them for sale. I'm absolutely thrilled that we haven't had to re-tenant any skilled nursing properties during this pandemic, and so we haven't had the challenge of testing the market. I think well, as any operator or any investor, you're just more comfortable with the core because you understand it more. The value added would have to be, I think, a real discount, and I'm hearing that there are no discounts out there, Ben. And if there are, let us know. The pricing is as strange to me that there has been no reduction in price we've seen in any of the assets. We have one skilled nursing property that's for sale. It's a one-off in a state that we don't have a lot of assets in, and we were just amazed at the number of people who were interested in buying this asset. So there are a lot of buyers out there that are private money. I'm more interested and I think the industry is more interested in the operator now than necessarily the asset. The operator is just, it's like, in real estate, location. In investing, it's operator. We have some very, very good operators, and we would really like to have opportunity to let them expand their portfolio, especially in the skilled nursing area. We were very lucky. We did a deal with Ignite last year, the year before, but we built one and opened it during the pandemic, and
Wow.
They were 63% occupied the other day. So, the right operator, the right location, and the right service level, because they're very acute, does work. So I'm looking for those types of opportunities to provide additional return to our shareholders.
Thanks. Ben, what's your take? What do you prefer when you see opportunities cross your desk?
I mean, you're always looking for opportunity, but we're the same. I mean, I'm on the real estate side of this, and I couldn't agree more with Wendy about it, the operator being so important. And so, while we're always looking for opportunity, if there is a core opportunity that can add to our operators portfolio, we have an operator in that area. We're looking at all kinds of deals. We kind of have a mixed bag as it is. So yeah, I mean, I think we're looking at both.
And do you have any theory as to why no one's offering discounts right now? I mean, you would think with is it just a matter of the federal government propping everyone up that they're in a stronger position now, or what do you think?
Well, I think you still have a lot of people that believe in the industry. I think the need for the industry, was demonstrated. I know early on there was a lot of deaths. Nobody was prepared for this, but I think this is something, again, that's around to stay. I think there is something to that. All these programs gave the operators cash so that they weren't desperate, and everybody does look at people look at the current environment as a temporary thing, so they're not going to give you a discount for something that you're not going to sell low, right?
Right. I think that's probably true of senior living as well. So talk to me, Ben, about home health agencies. And, the headlines are right now that, higher numbers than ever are being diverted home for a variety of reasons. Maybe just the whole stigma associated with all these negative headlines, as well as just the safety of, lower density recouping at home. Has that changed how you look at, how you're underwriting maybe and envisioning future occupancy or census and mix going forward, or how does that change how you look at it?
No, I mean, all the main factors that are driving people to home care today, again, are temporary factors. Isolation is a horrible thing, and right now, if you're in a nursing home setting, you don't have visitation. There are no group activities, group therapy. All these things aren't really happening, whereas many people have people at home, family, people are working from home, people are home from school. So being stuck in a room in bed all day in a building versus being home with family is a choice that a lot of people, would just prefer to stay with family. But as things change, as people go back to work, back to school, group activities and visitation comes back, which we're actually starting in New York on Friday. They just announced. That might flip, where at home you're spending most of the day alone, and in the facility there's a sense of community. Community group activities, group therapy, and you have, there's also people have some comfort being in a building, especially if it was their first event. They fell at home and now they're going through this traumatic event. They have some more comfort being in a building where there are always caregivers around and other people around. I think it's going to be important for us to demonstrate. I think the industry learned a lot about infectious disease from this. And I think there are going to be a lot of positive changes, some of which are probably long overdue. And I'd be curious really to see, things other than COVID, if some other things improved because of of how infectious disease control got better. And a lot of times when people are making that decision to go to home care or a nursing home, they're consulting with their doctor or medical professional. So I think it's on us not just to demonstrate to people in general, but to show doctors, referral sources, the measures we're putting in, what we've learned from this, because I think even if people have been reading the news and are scared today, in a few months or a couple of years, when they're making a decision, talking to their doctor who's recommending a nursing home is the best place for them to get better, I think a lot of that fear can easily go away if we do a good job of communicating that.
True. Wendy, do you also view home health agency diversion as kind of a temporary thing that's helping us get through the pandemic, or what's your take on it?
Oh, I 100% agree with everything Ben said. I think if the skilled nursing industry can develop and produce some outcome studies relative to comparisons of somebody coming into the nursing home and getting intensive therapy in the tricked out gyms that they have in nursing homes these days, instead of somebody going into the person's house with a big rubber band to do stress or exercises like that. I think in a vast majority of the cases, you're going to get a better outcome in a nursing home rehab than you will at home. I mean, if you are lucky enough to have 24/7 care at home, it is more comfortable to be at home, but I still think you're going to get rehabbed faster in a skilled nursing property. Another thing that I just don't understand the math behind the employees. Everybody's saying, even before the pandemic, we didn't have enough of an employee base. So if you take all of these people who are going to be able to see maybe 1 or 2 patients a day because of the travel between patients, and that person can see 4 to 6 people in a nursing home, I just don't see how that math works, that we have enough employees doing those services throughout the United States. So, home health was already taking some residents from nursing homes, but those are, I think, the top income level type people, or people who actually have a very, very strong family network that can work with them. That's just not the United States. That may be all the people we know, but that's just not the United States.
That's an excellent point you raised, as far as just finding enough labor and people to help do that. But we have an RN on staff, and she pointed out that the other issue with home health, and maybe it doesn't play out right away, is it's potentially ripe for elder abuse that wouldn't necessarily occur in a well supervised skilled nursing facility. So it's not the panacea that everyone recognizes.
Very interesting. Her mind goes there.
Right. Yeah. She does our clinical assessments, and yeah, she's definitely zoned in on everything that could go wrong. So generally, right now, as an appraiser and just the two of you out there looking at deals, I mean, there's so much disruption from COVID. We struggle with, okay, let's make certain we pulled out all the quote unquote COVID expenses out of the financials. We pull out all of the provider relief funds, any PPP money. We try and make certain we've correctly identified, advanced Medicare payments. There's so much static in what used to be just as a pretty simple T3, T6, T12, underwrite it, slap a cap rate on it, and be done. And what are the metrics that, Wendy, you're focused on when you're sizing up a deal?
Well, a component that's important for the next couple of years is going to be the transition of people from state to state, people moving. Where is the growth in the United States these days? It's a little different than it was before the pandemic was happening. So that's going to be important. It's going to be important for us to really understand the health of the states. It was always a governing factor, but I think it's going to be even more important. And then I think we're going to spend a little bit more time trying to underwrite the health of the other healthcare systems, like the hospitals, really delve into what is the health of the supporting healthcare systems and the referring healthcare systems within the marketplaces. Again, I'm going to go back to the operator. The operator is going to be paramount in their history. Operators have come through cycles before, and how have they done? I think we're going to, LTC has always been very focused on our coverage, and we'll also be very focused on our coverage, but it's going to be hard for us to underwrite a skilled nursing at 1.5 out of the box. So we're going to have to look at, how much are we going to be able to sort of justify a 1.3, that's going to be a 1.35 next year, and a 1.4. So, we're really going to have to look at what our underwriting criteria is going to be, and what we can live with going forward.
And when you refer to the health of the states, are you concerned about the ability of Medicaid to really cover the costs or sustain going forward, or?
Yes, okay. Medicaid. And well, since the Democrats are in power, I don't think there's going to be Medicaid waiver sent out anymore. So That's one thing. But, you know, the state of Texas is growing so much, and not that they're not fully covered by skilled nursing, but they're one of the lowest reimbursement states in the union for Medicaid. It'll be interesting to see. They've hit some very rough spots recently, and we'll see how the government. I think this is they're a 2-year budget cycle. I think this might be a budget cycle for them.
I think you're right. Yeah. So that should be interesting to see how it plays out. Ben, what about you? I mean, what are you focused in? What's most important to you when you're making your investment decisions?
Yeah, I mean, Wendy made a lot of really good points that I couldn't agree with more. The health of the state, but also the health of the immediate market, the feeder sources. You talk about Texas. There are a lot of very small markets there with maybe just one hospital that went 7 months without having an elective surgery. How are they doing? Are they gonna recover? What's it gonna take for them to recover? But look at the immediate market and the hospitals in that market. And also, you have to, when you're going into a deal, just assume that some of these factors aren't going away. We mentioned census, probably going to take a while to get back to normal, but also some of the expenses. You can't just assume that everyone's expenses are going to go back to pre-pandemic levels. Maybe there are going to be new things that we want to do when it comes to infection control, or that somebody hasn't been doing. Or, a lot of times, one of the great things about doing due diligence is many times we can learn things from people that we're buying from. So I think we're focusing a lot more on the small details, looking at everything we've looked at before with maybe a little bit more attention to the state and the feeder sources, but having the operator they've always been involved in the underwriting, a lot more involved, looking through everything that these providers have been doing. Maybe there's something we can do better, or that we need to improve going forward. So assume a little bit of the expenses some of them will stay, at least for a little bit, and that you won't have the revenue and the census coming back immediately.
So from your operators, are any of them concerned about liability insurance, which is something we haven't exactly seen hit just yet necessarily, although I am hearing horror stories of operators paying just exorbitant amounts with COVID carve-outs. And especially now that we do have Democrats in office, I doubt we're going to see any kind of widespread immunity agreement. What are you hearing from your operators? I'll start with Ben.
Yeah, I mean, that's a good point. That definitely is something that people are talking about, and we're having operators and in the insurance professionals. It's something that we have to think about. We haven't seen an impact from it yet, but it may be coming.
Wendy, have you seen anything yet, or are you hearing any rumblings?
Yeah, our operators are saying that the premiums are going up. In fact, they started going up last summer as soon as COVID came in. There has been a lot of concern about liability issues. There was a positive case out of California, strangely enough, last week about, but it was assisted living. So I don't know, there's a thought that the courts are not going to be very hard on people that have, it's COVID related as opposed to just bad care related. But you have to get to that judge first, and you spent a whole lot of money to get there. So if I were running a company, I would, years ago, I worked for a huge company, and we had our own underwriting group, and the guy who ran it, settle, and and we saved a lot of money by spending a lot of money. So I think that might be a good course of action for operators for a while, if you can settle it for a reasonable amount of money. But it is absolutely, that's probably one of the things we should think about. Texas, of course, has a huge tort reform law that is very, very strong. And, you know, that's another thing we should consider, and I'm sure Ben would agree with me, that, you know, what is the litigation environment in the state that you're thinking about buying something?
Yeah.
Very, very good point. So I want to switch gears here a little bit. I know Ohio is going on the record as far as actually buying back beds to reduce bed capacity, and they've actually put money aside to do that. I've seen headlines that nursing homes with lower density, more private units, no boards, fared better as far as infection control and COVID outbreaks, and picking up increased chatter. And of course, obviously, baby boomers, I would think, really all of us, would prefer a private room rather than a roommate in your 70s and 80s. Is there an opportunity to enhance value while you're reducing your beds in use? Wendy, what do you think?
Well, you know, I think so, but again, it is going to be the private pay or managed care pay resident, because the cost of the room and the care within the room, if an operator says they lose $10 a day on every Medicaid resident, and, you know, almost every facility has Medicaid, not necessarily predominantly Medicaid, but every facility has Medicaid. It's just not economical to have, you know, one resident with a Medicaid reimbursement. So our operators in the last several years have been decompressing or compressing, I guess, and taking beds out of service. And taking beds out of service is kind of interesting, because I don't know many of our facilities, unless it's a brand new property, that absolutely has in service the number of beds are licensed for. So it's a difference between the licensed beds and the in-serviced beds. So, you know, Ohio may give up 1,000 beds, but none of those beds were in service. So it's you know, just like anything that's global, the numbers are confusing. But no, I agree. I think there's more value in the private room if it's available. But there's always, I think, always going to be need for at least double occupancy in properties.
Thanks. Ben, what have you seen with some of your properties? Does it make sense to reduce capacity to, you know, and actually enhance the property's value by doing so?
Yeah, I mean, you do have to think about all the challenges associated with that that Wendy just mentioned. But this is something that we have been doing. We have done. We've done a bunch of ground up projects over the years, and a lot of those have been replacement facilities. In many cases, we're building something that's got more square footage than the building it's replacing, but we actually reduce the number of beds in use. Or buying a facility and building an extra wing on it without applying for more licensed beds, just to move some of those licensed beds into private rooms, and in some cases actually just buying a building and taking some of the beds offline. And it absolutely can enhance the value of the building. So it's really on a case-by-case basis, but it's been happening. We've been doing it. And I think it'll continue to happen.
So for those opportunities, you effectively just need a really strong rehab source to channel census to you, ultimately. Because I think to Wendy's point, you know, there's not a value proposition under a Medicaid regime. Is that correct?
Yeah, certainly. I mean, you do need, you know, none of these buildings that I mentioned are all private. They all have a lot of double occupancy rooms, and will continue to have that. But yeah, they have to be in strong markets where they're able to get the referrals to fill those single occupancy rooms. You know, census always helps.
Indeed. So that touches on something else. So even going into the pandemic, I felt like I spent an awful lot of time in the Midwest, in Southern Illinois, and Kansas, and Nebraska. looking at portfolios of distressed, largely Medicaid homes and kind of rural markets. You know, gosh, Texas, I think, is probably awash in properties that are relatively rural. Yes, maybe there's the one hospital that hasn't had an elective surgery in 7 months in that market. And I guess, you know, starting with you, Ben, I mean, what's the future of that rural Medicaid home? Is it viable as skilled nursing? Are there alternative uses? Are we talking land less demo and putting a cornfield in? I mean, what do you think?
I think so. I mean, this is an industry, again, that's here because there's need for it. And every community around the country needs it. People, no matter where you're from, where you live, people have medical challenges and need a place to get better. So there are going to be things they have to think about, and challenges in terms of how to get funding to them. But they're going to be there. They're going to exist. People will need them. You know, and when there's necessity, I mean, we tend to figure it out. But yeah, I absolutely do think that there is a future. Sorry, things are like, am I choppy? Because everything is.
You're good. You're good.
Getting choppy for me here. Okay.
Wendy, same question to you. You know, especially if we're talking a rural Medicaid facility that's only 55% occupied in Texas. I mean, I guess my question is, do you think, and maybe some of them are viable, but do you think that they're viable? And if they're not, then what do you do with it?
Well, if you say viable, are they profitable? So I don't think there's a public money investment case to be made for this profile. It's a social issue, and I think there's going to have to be more state support. And I am absolutely not advocating state run, because that never works. But what a state, I would think the best thing would be for a state to find some operators who are agile in running kind of intensive care type of skilled nursing, because these are generally custodial residents and not to be rehabbed and go back to home. A lot of these places that Ben's been in and you've been in and I've been in, Colleen, the people in these facilities have no place else to go, and they're virtually wards of the state anyway, and the state has put them there. So I don't think they're going to go away, but I don't think you're going to find them in portfolios of people who are going to be talking at these types of events.
Very fair. So I'll hit you with one last question, and you can shoot me later. How long before we get back to normal in terms of census? Wendy, I'll let you go first.
Yeah, I think skilled before assisted. And, you know, I'm thinking the second half of 2022, but it may happen sooner. I just don't know how exhausted the hospitals are right now. I mean, they went through an awful winter, and, you know, to get the elective surgeries scheduled and get the staff back on, you know, on a routine, I don't know how long that's going to take. But I think skilled will happen faster than assisted living.
Thanks. Ben, same question.
Yeah, I also agree that I think skilled's going to happen faster. People are going to go back, have elective surgeries. Things are going to happen as people start going about their daily lives that make them need a nursing home. But I think it will take a while. I don't think it's going to be 2021. I think it will go into 2022. I think it's healthy to think about the second half, to be conservative about it. If it happens quicker, then great. But it's you know, people that are thinking that the vaccine is out there and in 3 months or 6 months their census is going to be back up. I don't think that's reality. And it's also that everybody is suffering right now. So if one hospital starts having some elective surgeries, you know, every home in that market is chasing that referral. It's going to be tough.
Thank you, Ben. Thank you, Wendy. I really appreciate spending the afternoon with you, or morning if you're on the West Coast. And Chuck, I'm going to turn it back over to you now.
Thanks, Colleen. And again, thanks, Wendy, Ben. Much appreciate you having shared your insights on the investment case for skilled nursing, particularly in light of this pandemic. We welcome everyone to join us again on Wednesday, March 10 at 2 p.m. Eastern, 11 a.m. Pacific, for our next leadership huddle, which will highlight a recent property sales transaction as a case study to discuss the underwriting assumptions regarding near-term pandemic-related threats, return expectations during the pandemic, and long-term views on the sector and the respective property markets. Our panelists for the upcoming webinar huddle, leadership huddle, are Bill Pettit of Merrill Gardens, Brian Sunday of AEW Capital Management, and Trace Wilson of PGIM, and the discussion will be moderated by Beth Mace, NIC's chief economist. On behalf of the National Investment Center for Seniors Housing and Care, otherwise known as NIC, as well as Colleen, Wendy, and Ben, thank you for having joined us for today's leadership huddle. Please stay safe, maintain your physical distance, but keep connected. This concludes the webinar portion of today's leadership huddle.